Let's talk of female infertility, and really speaking, today I want to tell when should a couple really think of worrying and not worrying. So if you have been married for a year and you have been together for a year, you not use any kind of contraception and you are young, that means you are less than 35. If you are more than 35 and the same period reduces to 6 months. So if you have not used any contraception, you tried for a year, tried means really you know your ovulation period and you have tried, you've been together at least 3 times a week and you have not conceived, then you should think of visiting a doctor. Some people, if you're very young, say you're just 25, 26, then maybe even you can extend from 1 year to 2 years. So 2 years is the maximum time I would say, and you have been together again, not become pregnant, then time to visit a fertility consultant and just get your basic checkups done. The doctor can decide that if everything is coming out normal, can still give you more time or can decide to give you a little bit of help in the form of the assisted reproductive techniques which are available. This is also, I will take this minute to tell you that today if anybody decides to become pregnant, there is no way that he will not or she will not have a baby, provided you have the patience, the perseverance and the finance that goes with it. Because we have a gamut of programs available. If there is a dearth of egg or a sperm, you have a sperm or an egg donor. If there's anything wrong with the uterus, you have a surrogate. So you have everything available, provided your mind is open, you are ready to persevere. You don't give up, say after a cycle and say, no, I don't want a baby anymore. Because this whole thing is very emotional. And there's a lot of emotional strength required to go through the whole program. It requires you and your partner to be together, to be at peace and to have a very positive attitude. Only then you can ensure that success will be yours. So coming to the problem of fertility again, as I said, you've tried say for a year or 2 years, as whatever it is, but after 35 years, again, no more than 6 months, because that's the time when a woman's egg goes steeply, and I really mean the word steeply down. So don't give up your fertility for your career. There are a lot of women I know who would wait for their careers to be up and about and then try pregnancy, and they cross over this benchmark of 35 years and then it is a total downhill. I'm not saying that you don't get pregnant after 35, but the chances are so much lower. And then you would be opting for donors when you could have had your own biological child. So let me just say that careers can wait, but the biological clock just doesn't wait. At this instant, I would also tell you that the best eggs are between 21 to 24, when most of us would not even think of getting married. But even if you get married say at 28 or 29, you don't have the kind of 6 years, 10 years gap and then you can plan. I know of a woman who came at the age of 42 from US and she said, I've still not found the right partner. And she came for, can you preserve my eggs? You see, she's already lost the best eggs. So for women who are into modeling and celebrity industry and who don't want to have a pregnancy early in their life, then it is right time to cryopreserve, freeze your eggs and then have a baby whenever you want. At least you have this option. But for most others, I would say, please have your babies first and then maybe your careers can wait. So as we talk of female, let us just say that a female has to have a good egg for a pregnancy. A good egg means every month you have so many eggs starting developing, but it is one good egg which comes up, the rest of them all atrophy, and that one good egg, if it meets the sperm on the right date and that date, as I said, is very fixed, 14 days before your upcoming period, and the egg is alive only for 24 to 48 hours. So it just has, you have that 1 or 2 day window for for you to ovulate and for you to fertilize the egg. So it's so important to be together at that. So it's very important to check your ovulation, to check your fertility, to know that right date and be together. So there are couples who say they have been together all month long but not on the right date, especially for people who are working in far off places, would come for a little while and they would have passed years and not met at the right date. So it's so important. So female, it's important to know. The other thing very important, as I said, is the egg reserve. Some people are born with a less reserve. So at 28, I still would go for a simple testing and like an AMH. It's your egg reserve, your anti-Mullerian hormone. That value will just tell you. If your value is, say, anything between 0.8, 1, it's so low. I would say don't wait even for 1 month. Go ahead, try a pregnancy. But if her value comes at 3.5, 4, 4.5, give her a year, 2 years, whatever she's wanting before. So it is so important to know your egg reserve, and that is the first and foremost test that I would say that you go through. If that is low, as I said, if it is good, then of course you can wait for your time. The second important part in the female fertility is the tubes. There are people who have no idea on the tubal status. They have no idea whether the tubes are blocked or open. It requires an open tube from 2 ends, from the uterine end and from the ovarian end, to be open, because fertilization takes place in the tube. If the tubes are blocked on any end, the sperm, even if it travels from the uterus, is not going to reach the tube, and the egg also has to reach the tube. So both the ends have to be open, and fertilization will only and only happen in the tube. And if the tubes are not healthy, then sometimes the pregnancy will remain there. It has to travel. The functionality of the tube has to be good. It has to travel after getting fertilized in the tube into the uterus and get implanted there. But if the tube is defective, it will stay there and become an ectopic pregnancy or a tubal pregnancy, which is life-threatening. So it is important again to know the status of the tube. And how do you know that? By doing a simple hysterosalpingogram. That's a dye test. You push in a dye from below and you see the dye coming out from above, and you know you have a nice patent tubes. So, if the tubes are open, if you have a good egg reserve, the other thing that's left is looking at the uterus. If the uterus shows a good line, a good spongy line, say at day 12, day 14, it has to be spongy enough for the embryo to come and get implanted. It's very thin because of, especially in India, tuberculosis, repeated DNCs, repeated MTPs, girls get through abortion not realizing that we are destroying the lining of the uterus or the endometrium, and it will never become thick enough for the pregnancy to implant. So the 3 things, if we can test, the ovarian reserve, the tubal status and the uterine lining, and if all 3 are good and your age is good, no harm. You can keep waiting for a little while. But if any of the factors are not good, then you should take treatment, whatever is required. If the tubes are blocked, you have the option of going through a microsurgery. Get your tubes opened. If your egg reserve is less, there are some medications available which you can to increase the egg reserve. Not that you can do too much about it. And if the lining is not good enough, you have medicines that can, if you have Asherman, you have formed adhesions because of MTPs or DNCs, then get a hysterolaparoscopy done, get your adhesions removed, form a good lining, and then try again. So the idea is that a female should know how she is, how her reproductive organs are behaving, and the right time to go through it. Thank you.